On this episode of the Wealthy Podcast, I am speaking with Renée Gauthier. She is the executive director of the Rutland Community Clinic. Renée takes us on a bit of a journey on how she went from burnout as a nurse working in long-term care to finding her passion and being a part of an amazing movement to localize healthcare. Today on the Wealthy Podcast, I am delighted to welcome Renée Gauthier, who is going to help us tell the story of how we go from caregiver burnout and health system failure to hope, opportunity, and change in the face of some of our biggest healthcare challenges. No biggie, hey? Renée is the executive director of the Rutland Community Clinic, a relatively new and exciting concept clinic that essentially brings integrated primary care to some of our most underserved populations when, and most notably where, they need it most, in the communities they live in. After decades working as a nurse and in leadership positions, Renée could no longer settle for the status quo. And today we learn why this mission has become so important to her and how the Rutland Community Clinic is not only changing the lives of the patients and families they serve, but how we think about the delivery of healthcare in our communities. Welcome, Renée.
Thank you so much. Yeah, I've been very much looking forward to this.
Me too. So I'm going to really rewind. We have an opening tradition on the Wealthy Podcast. Because most of the people that are interested in coming and chatting with me have a deep connection to healthcare. And I just want to know, where did that start for you?
Funny. I was actually just telling my niece and nephew this story the other day, in that I had absolutely no intention of being a nurse or being involved in healthcare. I've always known I'd go into some sort of helping profession, but I did expect to be teaching or something else, something with kids maybe. And then I just found out that I love science. And so I loved, of all the courses in school, I loved learning about the human body and just how we work on the inside and how we're influenced by our environment and by those around us and our foods and all those things. And so when I graduated from high school, actually, my older brother had suggested to me that I go into nursing. His girlfriend at the time was doing nursing, and he just thought it was like a cool career, and I could go and stay with him in Vancouver. And so it was actually his idea. And I'm so grateful for that still, because I absolutely fell in love with it.
You found your thing.
Yeah, for sure. I love the relationship that you develop with patients, even in a fast-paced acute care environment. I always made it a priority, really tried to connect with my patients in the short amount of time they were there. And that's actually the reason why I loved long-term care, because you get to develop those relationships with residents and families over time. And I really just think that's a beautiful thing, to be able to get to know somebody and to serve them when they are, they're at their most vulnerable.
Yeah. And you and I have met and chatted a few times now. And every single time I am really so grateful for you, because I can tell how passionate and you are definitely living your purpose. Do you feel like that?
I really do. And particularly in this role,
yeah,
I really feel like the box has been removed, or I'm able to spread my wings and make my intention very clear and make real steps towards creating change. Whereas as much as I loved all the roles I've done previously, I felt like there was much more restriction on the possibilities and how I could do things. If you had a great idea, there was hurdles to jump, and there was, some red tape to get around in order to enact it. Whereas now I feel like, both because the nature of a CHC allows you to be more creative and more flexible, but also because I feel so well supported by my team, my board, and the community around us, that it's just given so much more freedom to try things. And I think that's where really cool things can happen, when we get to try our ideas.
So you referenced CHC. So that's Community Health Center.
Yes.
Yes. So before we get too far into our discussion, I think it's probably valuable to unpack what a community health center is, because my understanding, it's a relatively new concept. Or maybe it's just a new concept for us here in the Central Okanagan. But what is that?
Yeah. So CHCs, community health centers, have been around for decades. They really started showing up in Canada in about the 70s. But you're right, it was mostly on the East Coast. Ontario has tons of CHCs. But they are newer to BC. Some of them have been in BC for, 20, 30 years or more. But particularly in the Central Okanagan and in the interior region, they're fairly new. And so the idea behind a CHC is that it really is community driven. And so it is our job as the proprietors of a CHC to be constantly checking in with the community that we are serving. Are we meeting your needs? Who's here? Like, first of all, who is the community? What's the makeup? And what are the needs of that particular demographic? And then to continuously evolve our services as the needs of the community evolve. So both because we're learning more about what they need, but also as the needs changes, the demographics change over time. It is different than a regular family practice office. People often ask if we're a walk-in clinic. It's quite common that people think we are a walk-in clinic, and we're not. It is longitudinal practice for our family physicians. So we are attaching patients to a family doctor, but we're providing them with not just family doctor services, but with a whole complementary panel of allied health services as well, all within the same site. So you can go directly from your appointment in your doctor's office where you're talking about your sore shoulder down the hall to the kinesiologist in the gym and start to work on, some stretches and exercises or whatever kind of programming that they're going to build out with you. We also have nurses involved. And so that's helping us with streamlining access to our doctors. They do a lot of the front work, and they do a lot of the in-between. So maybe you only see your doctor, every couple of months, but you're seeing your nurse every couple of weeks for a little check-in to update things in between. And then we also have, we call it our healthcare navigation team. So we have a couple of social workers, one of them who's doing mostly counseling. And then we have healthcare navigators. And so the healthcare navigator positions, they're modeled after something I saw in another community health center, which is cross-cultural health brokers. And we've done a little bit of a scaled back version of those. Again, just testing to see, is this something our community needs? Will this be beneficial? And those positions, so they are filled by folks who represent the different demographics that we are serving. So specifically the different cultural groups. And so there is an element of cultural translation, sometimes literal language translation as well. But the goal for those positions is that they walk alongside the patient through their healthcare journey. So they provide some connection, like a bridge between healthcare services and the end user. They also help connect our folks that come through the CHC to other community resources, because there's all kinds of other organizations out there that are doing amazing work. And so they help connect them to whatever resources might be of greatest benefit to them. And they also just provide that familiar face of someone who, maybe hasn't exactly lived your story, but has a greater understanding than someone who is, always been raised as part of mainstream Canadian society.
Mm-hmm. I think that there are so many questions that I want to get to, even just out of that introduction. Can you tell us, I'm very excited about this concept, because I think I'm just going to go here. The mission we're on with this podcast is to start to open up a conversation around healthcare that isn't just focused on acute care, and starts to recognize that healthcare has to be a conversation around a whole person. And I think this concept, this community health clinic concept is that in action. So tell me, so the part that's really important, I think, about a community health clinic is the community, right? Tell me, so your clinic is in Rutland.
Yes.
So like for people that might be listening that don't maybe understand or know the nuances or the differences, or, you know, the opportunities, let's call them, that exist between communities. Tell me about Rutland.
Yeah, so Rutland is a suburb of Kelowna. Kelowna is a fairly large urban city. I mean, it's large for BC. And the population in Rutland is very, very diverse. So overall, it tends to be the area where newcomers to Kelowna settle. The estimation is about 70% of folks who are coming in from out of country to Kelowna, they end up settling in the Rutland area. So lots of different cultural groups, lots of different language groups, religious groups within the area. There's also a lot of seniors. There is, like, overall, the average income is lower than the general population in Kelowna. So it's quite a mixed group of folks. And that creates a lot of opportunity for diversifying your healthcare programming. So even something that we would think is fairly straightforward, like let's run a diabetes education program, we take the basic program and then we're needing to look at adapting some of the ways in which it's delivered, some of the content, specifically the directions around food or suggestions around, making shifts to diet. Right. They need to be tailored particularly to those different communities. And so I guess back to, the question of just like, what is Rutland or why is Rutland different or unique? It's really that full multicultural vision. Yeah. And you can really see it. I lived in Rutland like 10 years ago, and in the last 10 years, like, you can really see the difference. If you drive up Highway 33 now and you see all the different restaurants and storefronts and, languages on signs and things, you can see that there's really been a significant shift.
Yeah, and I agree. I was just up in Rutland last week at your clinic, and thank you for inviting me. They had an open house, a beautiful experience, and it has really transformed. And I mean, not that I want to be like tooting your horn, but like the Rutland Community Clinic is actually almost seemingly at the heart of that. Like, the experience that I had there, it's so bright. The energy is so beautiful. It's very open. And there's a lot of Indigenous art. It just feels very representative of that community. But I also think, like URBA, the Uptown Rutland Business Association, is doing a really good job of embracing the community that is there, rather than just sort of like settling into this stigma of what Rutland used to be. Tell me how it manifests then. You've sort of laid it out theoretically, and then we've talked a little bit about who the community is that you're serving. How does that like translate at your clinic? So you talked about the navigators, new Canadians, Indigenous communities. How does the clinic serve you? Okay, I know I'm talking a lot, which is not my job, but like I get so excited about this topic. Before we started recording, you were telling me about your staff.
Yeah.
So tell me how like this whole concept has actually manifested in every facet of the clinic.
Thank you. And thank you for mentioning the artwork as well, because that's really a point of pride for me, just in that we've really intentionally reached out directly to artists. We've had pieces commissioned. We've worked directly with the artists, and so far the bulk of the work is local Indigenous artists, which I just absolutely love.
It's stunning.
Thank you.
Yeah.
Thank you. And so at our clinic, you will see very quickly as you meet the team, most of the folks on our team are either Indigenous or are themselves first-generation Canadians, and that starts right at the front door. So it is quite a mixed, multicultural, diverse crowd, and those folks are in all levels of leadership, and as well as the board, which I think is really cool. I haven't had a ton of experience with board work, but the board looks exactly the same. It's a good mix of folks. And I think, again, that really makes an impact on our patients as they come in, because they're seeing folks that look like them, sound like them, right from the get-go. We are taking most of our referrals right now directly from other resource organizations. And the reason we're doing that is just because of our size and our capacity. We really can't just immediately be opening up our referrals to the whole of Rutland. And actually, just to give you a little bit of historical context on the clinic, when they first started developing the idea for this community health center, there was about 2 family doctors for 38,000 people in Rutland.
Wow.
And
that those 2 family doctors were located in Rutland.
Yeah, located in Rutland. Exactly.
Yeah.
Yes. So of course folks could be attached to physicians elsewhere, but
sure.
right within
in the
Rutland,
community.
In the community, there was 2 remaining practices.
Wow.
And so at the time when they started putting this idea together, the intention was to be serving the broad community of Rutland. And over the next couple of years, as they developed the project further, about 18 additional family physicians had signed on to start practices or to join practices in the Rutland area over the next couple of years. And so that allowed the board to really take a step back and think, okay, so if the issue is no longer just getting enough doctors into Rutland, then how can we best use our skill set, and how can we best set an intention for change? And so their idea at that time, and what's been our mission going forward, is to specifically be addressing needs for folks from seeking equity deserving communities. So we're looking specifically at newcomers to Canada, as we've discussed, Indigenous folks, women's health, youth mental health, and then we're hoping to start adding more LGBT and gender services going forward. That's something that we're just at the very beginning of building out. But it's just allowed us to focus our vision a little bit, and that's why our referrals are coming mostly from other organizations at this point in time. So we're working directly with organizations such as Kelowna Community Resources, which is the immigrant settlement agency in Kelowna, among many other things that they do there. Kelowna Friendship Society, Okanagan Nation Alliance, Métis Community Services. Those are our main partners right now. Because it's giving us access to those communities who either through historical trauma or just learning about the healthcare system, it would be more challenging to have those direct connections, and the trust building is huge. And so it's allowed us to really focus in on those folks who need these services the most. You touched on it a little bit earlier, but it's really about addressing not just healthcare, like you said, acute care, not just the medical needs, but recognizing that to care for a person, you really do need a holistic approach. And that means we need to be addressing all of the social determinants of health, right? So if you can't rely on where you're going to sleep tonight or how you're going to fill your belly, then, maybe your diabetic neuropathy is not high on your list of priorities.
Sure.
So we have to be able to provide services that address all of those concerns. And that's what we're seeing in our office. So in terms of how things are manifesting, we have folks that are coming in to see a family doctor. They can access the clinic from any point of service, but they're coming in to see one practitioner. And during that intake interview, we realized that there's other areas that require support. And so then we're able to refer them oftentimes just within house, but sometimes also out of house to have those needs met.
Mm-hmm. That is awesome. Can you tell me a little bit more about, you talked about the social determinants of health. And I think this is something certainly, you know, the KGH Foundation is becoming much more curious about as we start to dip our toes into health prevention and promotion and supporting services like the Rutland Community Clinic that have a mandate to provide that more holistic approach to care. So can you unpack that area of interest now that really we need to think about more when we talk about healthcare, if we actually really want to promote healthy communities?
Mm-hmm. Yeah, we need to make sure that people have access to all of the things they need to support health. Mm-hmm. So that might mean partnering with organizations that are providing like housing subsidy or like low-income housing, assisted living, those types of things. It might be connecting people to community. Like, so for example, we have quite a large number of refugees in the Rutland area, and they don't necessarily all come from exactly the same place, right? But if there are opportunities for them to be with other people, not necessarily to talk about the horrors they've been through, but just to be with other people in natural environments, that is so healing. It is so comforting, and that really allows the community to start to build itself, right? So it's not necessarily something that we are like, we've only been open for not even quite a year, right? It was November of last year. So certainly we can't take much credit for creating the changes in Rutland, but that's the type of change that we hope to influence going forward, is creating opportunities for folks to connect with each other. We know that that's super important for mental health. You know, I just can't imagine being in a new country and, you know, where everything is new. It's not just the healthcare system, but it's how you, you know, the transportation system, the school system, like just everything is so different. And so having opportunities to connect together is really important. Food security is also a huge concern for a lot of people. All communities, but in particular, again, our newcomers and our Indigenous folks, food security is hugely important. And so there are some great programs within our community. So being able to help connect people to those programs as well is very important, whether that's a food bank or whether that's like community gardens, things like that, that really give the power back to the community members themselves.
Yeah, I love that. I'm going to ask you now, you are Indigenous.
I am not Indigenous.
Okay.
Thank you for asking that question, actually, because I think that's really important. This is something to be totally transparent, this is something that I have struggled a little bit with understanding for myself. And I now have a really clear vision, I feel, of exactly what my ancestry means to me. And I think it's important to make that distinction. So I am not Indigenous. I have Indigenous ancestry. It is distant. And I think that's where it's really important to draw that line, because I have not lived the experience of an Indigenous person. I have not experienced racism. I have definitely let me backtrack on this a little bit. I am now, as my understanding grows, I am now really clear on the political impact of indigeneity. So I have Indigenous ancestry. I know exactly where it comes from. I'm found a picture of my, several great grandmothers. I can trace the family lines to the specific area, but because I have not lived an Indigenous experience, and because I do not deal with the social pressures and the consequence of that in my current daily life, I think it's very important to make that distinction. I grew up in a family where most of my siblings are First Nations or First Nations and Métis. And so for me, it was very validating to find that there was some connection for myself as well, some blood connection, because certainly that has been my lived experience. But I have borne witness. So I spoke to a really wise elder recently who, the way she framed it was, you have had a front row seat to an Indigenous experience. Mm-hmm. And that is not the same as being Indigenous yourself. Mm-hmm. And I think that's really beautiful. And it's not any less important. Mm-hmm. Like it's not any, right? It just, mm-hmm. for me, it's there. What she said is there's people that are, that their purpose is to be a bridge. And I think that fits me so well.
Mm. I thank you. These are topics that are hard for us to wrap our heads around. And I think, we're just coming off of our National Day for Truth and Reconciliation. And this is an important day in our country. And having really honest conversations like this are, I think, important, because we're also sort of trying to figure out how we fit and how we can contribute to this in a meaningful way, right? And I love that you've been able to articulate how, or you're trying to articulate how you feel about your role in all of this, because I think we're all trying to figure that out as well. And certainly your experience has allowed you to have a deeper sense of empathy, I think. And also you're really motivated, right? Tell me about why it's important to you, and I think to our health system, to recognize the unique characteristics of our Indigenous patients and families that we serve.
Yeah, thank you. It's just so important. Mm-hmm. It is so incredibly important. And I truly believe that, while a lot of the focus of this conversation today has been on our newcomer population, for me, the work needed to start with developing relationships with our local Indigenous communities. And that really is because of how I feel about Canada as a whole and the importance of the work that needs to be done to truly embrace reconciliation and truly make the impacts. I know there's been incredible work that's been done over the last few years around removing long-term drinking advisories. The statistics are pretty great, actually. The most recent I saw is that there's like 130 something long-term drinking water advisories had been removed in the last little bit, and there's still 30 or so communities that are impacted. But that's just one example of the areas in which we have historically, intentionally, and over a long period of time, let our Indigenous, friends, neighbors, let me rephrase how I say that, but over a long period of time, we have allowed the disparity mm-hmm. to be continued mm-hmm. with, honestly, very little effort to rectify. And growing up in the communities that I have and with the family mix that I have, I have seen the drastic difference between, the the privileges and the luxuries that I've been able to experience, like even as like a lower middle class individual in my day to day, compared to the absolute poverty of cousins. And so for me, it's just incredibly important that we recognize that part of the Indigenous way is welcoming and bringing in. Like I've never been to a gathering hosted by Indigenous folks where you weren't absolutely embraced and fed and everyone gets an equal share and really taken care of in a beautiful way. And to understand that that was the way in which the newcomers of the time, right, the settlers were embraced, received. Yeah, exactly. And then you look at, how things have gone since that time. And I think it's just, I'm really over waiting for change to happen and recognizing that as, as citizens with the right to vote and raise our voices and create policy, some of these changes can happen at the micro level and grow from there, as opposed to waiting for changes to happen from the federal government and filter down. If we just actively start embracing Indigenous culture, Indigenous people, and making the changes, I think that's the only way to move forward.
I love that. And it's kind of, this conversation that we're having is difficult. It's hard, right? I know that we're trying to frame this in a way that is as sensitive as possible. But I love what you're saying, because it would almost seem like it is reinforcing the inadequacy, I think, in how we have related to Indigenous communities by imposing Indigenous legislation. That's not to say we don't need it, but it's almost, again, reinforcing that power differential, right? Whereas if it comes up from community and is built from community, and those of us who are settlers have the ability to feel a little bit part of that, right? Feels more as my understanding of some of the cultural nuances of Indigenous communities are, that feels more genuine and authentic, right? It's like sort of built by people through shared experience, through community, through ceremony, through relationality, right? As opposed to like top-down imposition, which again, we do need that because we live in a society, and so we have these constructs, right? So that we all know how to behave and live and relate to one another. But that doesn't mean that things can't change from the grassroots level, which is what you've done with the Rutland Community Clinic. You've literally just said, okay, great. Y'all do what you need to do up at the federal level. But over here in Rutland, we're going to do things differently. Where did that, so this is not just a professional mission that you're on. It's personal.
Absolutely.
Tell me how you went from being nurse Renée, great nurse Renée, to the executive director of a really, enlightened community resource like the Rutland Community Clinic.
It feels like pure luck.
I know it wasn't, though.
Yeah, I just don't. I am a very spiritual person, and I think that we draw these things to us. I truly feel that this is a place, like I said, where I can make a real difference, and it aligns so perfectly with my personal values and my interest in creating change, and it's creating a better world for for my family, for my nieces, my nephews, my sister and brothers. And that's just so incredibly important to me. But in terms of like specifically how I came into this position, it really was a bit of serendipity. I had a bit of a rough time over, a few months to years, just getting burnt out in a previous role.
Sure.
And
you know what? I encourage you to be honest about that. Like, I think that experience is quite common, particularly for nurses working, whether it's in acute care or in community.
Yeah, like just always, this has always been in my nature to want to make change, to want to make sustainable change and just make the world a better place. And it's exhausting sometimes to do that when it feels like the system is changing so incredibly slowly. And over the last couple of years prior to moving into this role, I really had put myself forward on my team as someone who wanted to bring cultural issues to the table and, share my concerns about how our Indigenous residents were, the resources they were offered. It's not that I felt that they were being treated poorly by the system, but I felt like they could be better supported. And in particular, like the percentage of Indigenous folks in our long-term care system is very, very small. And so it's incredibly isolating when they come into care. And so I really just got burnt out on sitting at tables where it felt like everyone was in agreement that change needed to happen, but it didn't feel like change was happening. And Sunday night, and I said to my wife, like, I cannot continue to do this. Starting tomorrow, I need to start looking for something different. And I kid you not, Shauna, I got to work in the morning. I checked my email. I started doing, my regular Monday morning routine. And I got a text message from someone else, a colleague within the organization, who said, I've just heard about an incredible position and I think it would be perfect for you.
Wow.
Yeah. And it still just gives me like a shivers when I think about that. And then sitting down with our founding doctors, Janet Evans and Milt Stevenson, and having conversation about what their vision was for the community health center. And I'm like, this is me exactly. This is what I want to be doing. And so since day one of coming on board, I have prioritized building relationships with the Indigenous organizations locally. We do still have obviously a ways to go, and we have in particular I would like to have better connections with our folks at West Bank First Nation. That's we definitely intend to put effort and work into that relationship, but it has been my priority because I really think that we can't do a good job of serving our other vulnerable populations if we don't start there. I really feel like those relationships are fundamental in changing practice as a whole.
Totally. You learn so much, right? Yeah, that makes so much sense. And so you get the email, and then how long in the making has this been?
A handful of months. Yeah. A handful of months for the turnover to that position. And then I started the day before we opened our doors to our first patients. So a ton of the work in terms of building the structure and, getting some of the initial staff hired, and some of those pieces were already in place. And then it's just been full steam ahead since then.
Totally. And it's truly a testament to your leadership, the direction and the experience of the clinic, for sure. I know that the team is really integral, and the founding physicians, all of that, but it really, my understanding is it really has been your direction and leadership that has held space or opened up the opportunity for it to really sort of be that beautiful jewel sort of in the center of Rutland. It really feels, I know I'm very waxing poetic on this, but I went up there. It was a beautiful sunny day. It's fall is in, full force here in the Okanagan. And it just felt like a real beacon of hope up there. And everything that you've been sharing just with regards to the prioritization of understanding and listening and adapting the care model as you go, rather than kind of just like, this is the way we're going to do it. And these are the processes and blah, blah, blah. But just being more like, okay, so now we're serving these communities. What are we learning? And you told me about your nursing staff, which I'm circling back to because I think it's so cool. You have 4 nurses?
Yes, we have 4 nurses.
4 nurses. And 2 of them are male, which is unique in and of itself, I think. Getting less so, but still unique. And they're Indigenous.
Yes.
2 male Indigenous brothers.
Yes. Which is so cool.
Which is amazing.
Yeah, absolutely.
Yeah.
And then our other 2 nurses are both first generation Canadians.
Right. So how would that feel? We always try to think about how that would feel as a patient or a family member supporting a patient coming through the doors of that clinic. You walk in, it's bright, it's clean, it's beautiful artwork, and you're greeted at the door by somebody who looks like you, and it all feels a lot more welcoming than maybe what you're expecting. Yeah. And I do think that I know you're very humble, but credit your leadership in that regard, because it certainly is evident, all of the things that you're saying, that true passion for making a change.
Thank you.
Yeah.
And certainly it's been very important to us as we build our team that each team member carries the same outlook.
Yeah.
They carry the vision, and it really, it would not be possible without everybody really holding that and holding themselves to a very high standard of both of care and, that willingness to grow and learn, and understanding that we are going to keep shifting. Like there's not going to be a point where it's just finished. We will keep adapting as we go.
Which is amazing. I mean, I love that. I'm not the one that has to like implement care. So I understand that sometimes, it's good to have structure and process and all of that. But at the same time, being able to be responsive and nimble to the communities that we're serving in real time is the benefit, I think, of having these community health clinics.
Yeah, absolutely.
Yeah.
And really creating space where you can get that feedback.
Yeah.
So we are moving forward with our developmental evaluation project, which was sponsored by KGH Foundation.
Do tell.
Thank you very much.
I didn't want to bring it up, but
which we're so excited about, because a big part of the developmental evaluation project is creating community feedback tables, right? So community advisories where we meet with members representing the different communities that we're working with, and some folks that are also patients at the clinic, and hearing from them directly, right? Like, what is working for you? What's not working for you? Where are you needing more support? How would you see things changing over the next year or 6 months or whatever it is, and being able to make those in time changes. So like a couple of examples that are exciting for us. So one of the things when we first met with Kelowna Friendship Society, one of their primary concerns around healthcare was foot care, which sounds really straightforward. You can hire an LPN in the community to do foot care. But
foot, like feet, like your feet.
Yeah, okay. Exactly. Like, and you require special certification. So, nurses can go and get some extra education in order to be able to do foot care. And but it's a real concern for the elders in their community. Interesting. And it's fairly expensive. It's cost prohibitive for a lot of people to have professional foot care. There's, as we know, higher rates of diabetes in Indigenous community, and that's when foot care becomes exceptionally important. And so that was one of the first asks, was like, well, do you have anyone who does foot care? And no, we didn't, but we have prioritized. We have 2 nurses right now that are currently taking their foot care course.
Amazing.
So that we can offer that type of service. We had another ask recently for like, do you have diabetes education that you could bring in? And no, we don't, but we know who does. And so we'll connect and we'll get that information together. But just being able to accommodate things that, again, like it's just toenails, but it's so much more.
Totally.
Yeah. And to be able to provide it in spaces that feel safe for those individuals. So they don't have to drive to Rutland or get a ride or whatever out to our space to have the foot care done there. Once we're operational, we'll be able to do a mobile service where we can go and see, a handful of folks a day, so they can sit together, and it can be, part of like their regular, like folks that they're comfortable with and used to in an environment that they're comfortable with, because we know that due to the historical trauma and ongoing trauma, a lot of our Indigenous folks are not comfortable in healthcare environments. So the more that we can provide those services in spaces where they feel comfortable, the easier it is to build relationship with the community.
Which is, again, circling back to the unique approach of community healthcare, if I can call it that, is that it is responsive to the needs of community. And I think that's part of the reason why I want to talk a little bit about funding. It's important, but I know the KGH Foundation, our mandate is, world-class healthcare close to home. That's what it says on all our marketing things. But that means very different things if you live in the Upper Mission and if you live in Rutland and if you live in Lake Country or West Kelowna. And I think this is part of the awareness that we're having as an organization, is that healthcare shouldn't be one size fits all. And that adaptability and also the feedback loop is so vital. I think many of us, whether we're in marginalized communities or not, feel disempowered in the current health system because there's nowhere for us to talk about what we need. But certainly there are more barriers when language is a barrier, when trauma is a barrier, right? So this was part of the reason why we're so excited about the Rutland Community Clinic, and then supporting this particular initiative, which facilitates that feedback loop, right? Which is truly what makes the community clinic really special. So let's talk about the funding model. I think it's important because, yes, the KGH Foundation has provided funding for specific initiatives that wouldn't otherwise have been funded by the province. But the clinic is funded by the province.
Yeah, so we are considered a strategy-funded community health center, which means that all of our baseline funding is coming directly from the Ministry of Health. So they've provided funding for us to rent the space, keep the lights on, do all of the tenant improvements, to, take a tech office and turn it into a doctor's office, as well as for most of our staffing positions. And that is very different than how most community health centers have historically operated. So when I go to our BC Association of Community Health Center tables and chat with other folks at that table, we are in quite an envious position in that these other organizations, they are nonprofits and they have had to hustle every dollar since the beginning. So they have people that are constantly looking at grant funding, they're doing independent fundraising, they're doing all kinds of things to make the money to support their organization. And yes, we would love to be making more money so that we can grow our program and, build things even, more extensive than what we have currently, but we don't have to worry about keeping the lights
infrastructure
on.
for
Exactly. Yeah. And so that's huge. And we're not the only one. There are a few other community health centers, strategy funded ones that are popping up around BC. And it's certainly something that we hope to see continue to grow. These types of health centers are so important to the sustainability of primary care, in order to be able to provide that equity of service to folks, and in order to be able to create environments that are like really appealing for healthcare workers to work in. People love to work in an environment where they feel like they're making a difference, where they can hear back from the community directly about the impact that they're having, that feels good. And most people who are in any job in healthcare were drawn to their profession because they want to help people.
And I'm glad that you brought that up. There's a couple things in there, but do you feel like that's something maybe that was missing for you when you were working in the health system prior to this role, is that there's not that continuity piece and the feedback?
I think for me, honestly, I just outgrew the role.
Okay.
And not to say that, like, I mean, I know people can stay happy for a very long time. They can, that's an end goal position for a lot of people. I was in management and long-term care, and it is an end goal for a lot of folks. But for me personally, it just didn't allow me to create the changes that I really feel are part of my purpose. And COVID was huge. Yeah. COVID was soul crushing for healthcare in general. And because of the widespread burnout, it's made it a very challenging environment to be your best self. When most of the people around you are feeling burnt out as well, you're just not having the same kind of camaraderie or excitement, things like that really drew me to nursing initially, or that I really enjoyed about nursing initially.
Like the teamwork and
the teamwork. Yeah, exactly. The, all the laughing in the hallway and doing a great job and then going home and being proud of that together. And we're now, and I mean, long-term care has been particularly hard hit by the healthcare staffing crisis, constantly worrying about who was going to be there for shift, were we going to be able to make it through, who was going to be furious with me for things that were well out my control. It just wears on you. It just wears on you. And I feel like I'm a very strong person, and I managed it as best I could for as long as I could. And I chose to do something that more closely honored my vision for myself and for my life.
So I'm going to ask you, like, what would you say to somebody who maybe is still really committed and passionate about healthcare and, the helping positions, right? But maybe stuck feeling like, I'm burnt out, or I'm in an environment where I'm just not able to, I'm not happy. Yeah. What would you say?
Oh, I feel for you.
Yeah.
Yeah. And that work-life balance is so incredibly important. And so you might have to take a really good look at how you're doing that.
How did you figure out, like, you said you had the conversation with your wife and you're like, this isn't working for me. It's not aligned. Right? Like, how do you know what is? How did you know? Like when you got that email that you're like, yep, this is it.
Yeah, very good question. I think it became very clear for me, like when I sat down with our founding docs and really talked about it in greater detail of like what the vision was for the clinic. And I mean, I might still have 10 more jobs before I'm done, right?
Sure.
Yeah,
you're young.
Yeah, that's the nature of, I'm someone who loves to learn and do new things, but it feels different. It just feels different. It's the way that you feel when you go home at the end of the workday. That is the greatest difference, because I can trudge through almost anything for 8 hours, right, and do my best to do the things and get through the work and follow the program. But at the end of the day, I now feel full and ready to go and engage with the rest of my life, with the other half of my life that creates that balance, as opposed to feeling depleted and like I need to just turn inward and do nothing because you have nothing left. I'm totally empty. Yeah, exactly. It's that difference. Whereas I now feel more ready to engage with all of the other things that actually create that balance in my life.
Well, the first step for anybody listening that may be feeling that way is to put it out there.
Absolutely.
Yeah. I do call it in, right? I do love that. I'm also very spiritual as well, which is funny because we do a podcast and talk to a lot of, doctors and clinicians and researchers and people that really are like into science. But actually, there's a lot of there's a lot of crossover in there.
Yeah, absolutely.
I think that there's like things that you can know because like we've studied it and we have stats and data, and then things that you can know because like or you like work with people. And this is my big realization about data is like it's like population data, but it's not a person, which is very different, right?
Yeah, absolutely.
So persons out there, if you're feeling like that, put it out there. Just call it in. Woo woo. There's my woo woo moment.
I love it. Thanks for that.
Okay, so I'm just going to switch gears a little bit. This has been such an interesting conversation, Renée, and thank you for being really vulnerable, talking a lot about your own personal experience and how that has impacted your choices and your work and all of that. How has your definition of health and what constitutes health care changed over the years?
I think I really appreciate now, like health is more than the absence of disease. It's a phrase that I've heard used quite a bit, and it has always made sense, but now it really feels true. I can be unhealthy even when there's nothing physically wrong with me.
Totally.
Right?
I mean, arguably, you were totally physically fine in your previous job, but not healthy.
Yeah, absolutely.
Yeah.
And it's that total balance. It really is that holistic approach. It is the, a healthy mind, body, spirit, working cooperatively together. And for me, it really is that feeling of having energy and enthusiasm to live my life outside of work.
Mm-hmm. Yeah, I love that. When we come home at the end of the day from, the work that we do, does our battery feel depleted or are we charged?
Yeah.
Right. I'm also very lucky. I, like you, made a decision almost 9 years ago to dip my toe into nonprofit, use my superpowers to change the world, and have never looked back. And I do, obviously there's hard days, right? And just long days and all of the things that are associated with a job and a commitment. But I totally resonate with what you're saying. I get home and I'm like, I have energy to go for a walk or, hang out with my husband or make some food, which I don't really love doing, but, it's just part of being a mother. But you know what I'm saying?
Yeah.
It's like, it definitely is a different feeling. And I wish that for people because
Absolutely.
That is what health is. Okay, so we feel very clever on this podcast because we came up with the name Wealthy.
Right.
And it's sort of like a double entendre, right? Which basically means that health is wealth. And we've just discussed that there's very many aspects to health. Mm-hmm. Everything from mental, physical, social, relational, financial, like all of these aspects. What areas of your health do you feel wealthy?
I feel very wealthy in love, which it's that wraparound love, right? Like I have my beautiful wife, and then I have nieces and nephews, and really close with my siblings, and amazing parents, and that just makes me so fulfilled and so happy. And it carries over into so many parts of your life, right? Those are the things that allow you to weather the storm in other areas when you know you have that solid base. So I'm incredibly grateful for that. And then I think over the last few years, also just being more grounded in my spirituality. I'm very much like a nature-based spirit person. And so
me too.
So getting really comfortable and just like, well, it might not be for everybody, but I am gonna, sit in this garden and just talk to the plants, and that makes me happy.
Oh my gosh. I totally get that. Like literally my happy place is just, there's this like spot where I go with my dog and I just hike up, and like there's like nothing around. And it's just super quiet. And I'm like, oh my God. Oh, this is a lot right now. But I'm like, I can feel like whatever God is, I feel that, it just is like, anyway, that's a whole other podcast. But I do think having that sense of connection to something bigger than yourself is definitely a source, right, of inspiration and peace, and like all of the things that sometimes I think we're maybe lacking in this crazy busy world where we get so consumed with doing. And there's an opportunity every time, for me at least, it sounds like for you, whenever I step outside my door, to just like remember why we're here.
Absolutely. Just feel the wind on your skin and know you're alive.
Yes, it's just the best thing ever. What areas of your life are you curious about or you're working on?
I really want to learn to like herbal tea.
Well, that's honest.
And
why?
So this is my goal for the year, is to learn to tolerate some herbal tea. I so believe in the power of plants.
Okay.
Logically, and in my heart, but not so much in my mouth.
Oh, interesting.
And so I know there is powerful medicine in the plants around us, and I love to harvest. I love to grow things. I love to harvest things. I like to dry them on strings in my kitchen.
You just don't like to drink them?
No.
Oh, no. What if you put some mint in there?
You got to mix it up, I guess.
Yeah.
And maybe a little honey or whatnot. But for me, I think that would create better balance in my life, because currently I'm a black tea, cream and sugar. that would be helpful.
Goals.
Yeah.
This
goals.
is good.
Yeah,
like,
exactly.
Sometimes they don't have to be super lofty. Like, just little ones.
No,
that's your bridge. That's your entry point.
Absolutely. And I have, like I said, I have a very full family life, and my work is very fulfilling. And so, some of those me things can be a little bit more straightforward.
Well, I wish you much luck on your quest to become a herbal tea enthusiast.
Yes, thank you so much.
Well, this has been super fun. And again, like I said, I really appreciate you coming and doing this. I know, it's new for you. You did a great job. Thank you so much for really, I think, articulating that there is still pathways for people that truly, genuinely want to make a difference in our community. And then for helping us understand how important local healthcare is.
Absolutely. Yeah. Thank you so much for having me and for making this easy and comfortable today. I really appreciate it.
You're welcome. Anytime.